Good morning, everyone. Today is Thursday, November 15th. Thank you so much for joining into our weekly healthcare reform webinars. My name's Deb Wilkinson. I'm the Vice President of the Health Plan Options Department at URL, and we have a strong team behind me that does nothing but support you and your sales. So, with these webinars, we've been running them for more than 5 years now. Hopefully you find them a place that you can get your questions answered and learn new things that are going on legislatively, not only in our Commonwealth level, but also the federal level. So there are a couple ways that you can ask questions, and questions are definitely encouraged. You can raise your, electronic hand icon, which is in the control panel to the right of your screen, or you can type in questions in the question box, and I'll answer those at the end of the webinar. So if you are not new to this webinar, you know that I'm old and I struggle with technology. So just with a show of your electronic hands, if you can hear me okay and see my screen okay, if you can just throw up your hand. I don't see any hands. Okay. No hands. Oh, there are the hands. Thanks, guys. Whew, I just had a moment of panic. So let's just get right into the agenda. We did talk about the open enrollment. Obviously, that started November 1st. We are 2 weeks into it. Enrollment is supposed to be lower than it was last year. I mentioned the figures last week, and that could just be because of this is a national stat, so it could be that some of the states are offering association health plans or the short-term limited duration policies, but it is definitely in gear, and it rolls through the 15th of December, so we are 1 month out until it ends for a 1/1 effective date. There are some issues here in our Commonwealth. The carriers, obviously, they have to send out renewal information. With our particular Pennsylvania carriers, it looks like the information they had at the time was the 2019 rates, but the 2018 subsidy amount. These amounts are drastically different than what your clients that are subsidized may actually end up receiving. So I am encouraging you to, if you are still in this market, or if you get a call from one of your clients or a client, make sure that they update their income, because that will reset the system, because certainly they don't want any surprises as they move through the first quarter and as the marketplace pulls tax documents and resets those incomes. For instance, one of our agent partners had a client with one of our health carriers here in Pennsylvania, and they had an estimated premium for 2019 of $8.49, where they paid $540 last year. The actual correct premium was about $440. So you see that if he did nothing, this client, he would have gone from an $8.50 premium to $400, and he would have had to have made up that premium once the tax documents were pulled. So just, I won't belabor the point any longer, but just please encourage your clients to update their income. We talked about last week, President Trump released new regulations that relax the employer requirements to provide birth control at no cost to their employees. And the new regulations apply mainly to the religious organizations, nonprofits, and small businesses that have religious and moral objections. But it does also extend to institutions of education, insurers, and individuals as well. Rules will take effect after a 60-day comment period, so we're still at the very beginning of that, but it is something that you should be aware of. Additionally, there are proposed tighter rules on the ACA plans that cover abortion. The administration said that changes are intended to ensure that, obviously, taxpayer-provided subsidies are not used to pay for abortions. So that's really it on the legislative updates. We'll have essentially a new Congress, new Senate nationally as of January, and in Pennsylvania, they just did their leadership elections, and there are certainly some changes within some of our Commonwealth committees, specifically the health, both on the Republican and Democratic side. Short-term limited duration, questions on approval. Where are we so far? We still are at ground zero. The 364 days are not approved in Pennsylvania at this point, and all I can tell you is if you're selling short-term policies, please stick to the 89 days, no more than that, to avoid any issues. Broker of record news for NEPA, Highmark East, they are allowing brokers to be paid for non-brokered groups for January of 2019. So this is a huge opportunity for those in the Northeastern segment to really market to these groups that are non-brokered at this point. And if you get the BORs in, you can take over and they will be commission paying as of January. So again, a great opportunity. So hopefully you'll take advantage of that. Group health submission deadlines, the November and December information is attached. Just of note, today is the cutoff for capital. We have inclement weather. It is actually snowing right this minute. So we are hoping to get some sort of extension, but that is not guaranteed, not approved yet. On our next slide, I do have some information of where you will send groups in the event that we close early. 2019 individual information is on our site. We have the INSS quoting portal as well. So that is under health plan options, under quoting tools. So you'll be able to go in there and see what no matter what state you're in, if your state is working with the marketplace, then you will be able to preview those rates and estimate subsidies as well, but you cannot apply from the site. We talked about this as well, that it's important to keep this in front of you. Your October commissions obviously paid. There were commission retractions, for the under 65 and over 65 med subs. So, under 65 business, individual and family business, and then of course the over 65 Medicare supplements. I'm just asking you to review those chargebacks, compare them to the November and quite possibly the December statements as well, because I do think it will take some time to have capital work through these issues. So just keep those in mind and look at those statements so that you're getting paid for that hard work that you've done. Fourth quarter call volume is very heavy for those of us that are in the group health market and of course Medicare market. So I just wanted to let you know some of the resources that we do have available. If you call in, leave a voice message, our standard operating procedure is that you will receive a call back the same day. So no need to leave more than one message. It's just heavy volume time. So, our apologies for that, but that's traditional fourth quarter madness. And we also do have a group health resource page on our website. Again, if you go to URL insgroup.com and under health plan options, group resources, it's going to give you all the forms for every carrier that you would need to add an employee, terminate, submit a group, quote for a group. So please utilize that as well. Cap Blue Cross group submission email, of course, this is in the event that we do close early, and we probably will be doing so. If you have a Cap Blue Cross group to submit, again, today is the cutoff. We're trying to work with Capital, but I'm not sure that we're going to get any sort of exceptions. So if you are submitting a group, email Ashley Kemmer, who is our small group Cap Blue Cross rep, and also Cap Blue Cross NG, so CBCNG at capbluecross.com. And if you could please CC Elise or your case manager on those, I would appreciate that as well. So that's it. That brings us up to the open discussion. Just of note, the next webinar is 2 Thursdays from today. Next Thursday, hopefully we'll all be with our families enjoying time together and the Thanksgiving holiday. You'll notice I did put the frozen tundra here just to represent what we are expecting as far as weather today. And that's it. So let's see what sort of questions we have. We have no questions today. I guess everybody's tired and looking out the windows watching the snow. As always, I do appreciate you joining in. If you have any questions, you can reach me at this number, this email, and of course our website, urlinsgroup.com. Because we won't be together next Thursday because of Thanksgiving holiday, I just wish all of you a very happy and healthy Thanksgiving to you and your family. Please enjoy the time that you have with them. And thank you as always for joining in, and I wish you a great and safe balance of the week with this inclement weather and a wonderful weekend. Bye-bye.